Hello everyone, my name is Megan Abreu, and my topic for this week's current event is medical errors. Medical errors can be medical, such as misdiagnosis, delayed diagnosis, or like a hospital-acquired infection. They can also be clerical, such as a medical billing code error. Those are just a few examples, but I chose to focus a little bit more on the medical malpractice claims aspect of medical errors, and I found an article titled "A Missed Opportunity for the Malpractice System to Improve Healthcare" by Aaron E. Carroll. This article explains about how 2% of doctors accounted for roughly 39% of all claims in the United States. Of course, there are certain subspecialty groups that are more susceptible to medical malpractice claims, and those include surgery, OB, and also emergency medicine is one of them as well. So he mentions other correlations like being male or being around the age of 40, but he also goes on to cite a study in the New England Journal of Medicine, which looks at this group of high-risk providers and analyzes what happens to them after lawsuits. They use the National Practitioner Data Bank. So this is just a database that tracks medical malpractice claims and adverse action reports on healthcare professionals. It prevents essentially practitioners from moving from state to state without having any kind of their adverse medical malpractice suits following them. So essentially, this 10-year study found that 0.2% of physicians accounted for 12% of all paid claims. So as you can see, there's a trend here. This study looks into whether these physicians moved or changed jobs after these claims. It turns out that the more claims that a physician had, the more likely they were to retire. However, 90% of physicians who had 5 or more claims still stayed in practice. They were not any more likely to move to a different state, but they were more likely to go into private practice. When it comes to medical malpractice, there is a correlation between diagnostic testing, death, and cost. I did a little research on cost and found that providers do admit to defensive testing. For example, doctors may avoid certain patients, procedures, or geographical areas that are associated with a greater medical malpractice liability rate. They may also overtest or increase their diagnostic testing just to cover themselves, even if they think it might not be necessary at the time. We can see that medical errors are currently the 3rd leading cause of death behind heart disease and cancer. This statistic was generated by Johns Hopkins patient safety experts in 2016. I also found a study published by the Harvard School of Public Health, which states that the annual cost of medical malpractice in the United States is roughly $55.6 billion a year, $45.6 billion of which is spent on defensive medicine. That study was published in 2010. It's a little bit of a challenge to try to find definite numbers, but the American Medical Association released a series of trend reports in its policy research perspective. Their second report revealed that the average cost on medical claims that were closed in 2015 was 64.5% higher than in 2006. In 2015, 68.2% of all closed claims were dropped, dismissed, or withdrawn, yet still incurred an average cost of $30,475 to defend. The third report revealed, despite increasing stability in insurance premiums, more premiums increased than decreased. In 2017, 13.4% of premiums were higher than those in 2016. I did try to look at this article for a bias, so I researched the author. Mr. Carroll is a professor of pediatrics at Indiana School of Medicine. He's also the vice chair for health policy and outcomes research, as well as the director of the Center for Health Policy and Professionalism Research. So he is absolutely qualified to write this article, and I didn't identify any kind of bias in it. Essentially, to conclude, malpractice is an all-around tricky subject. I think we want to instill change in a positive way where we can reduce medical errors and improve quality, but we don't want to encourage more of a defensive posture for physicians. Thank you.